It's my great pleasure to welcome you to this awards and recognition ceremony. We're here today to honor and appreciate those who have helped us on the journey so far. We believe that those who have contributed in one way or the other in making the NSSF what it is today need to be appreciated and recognized.
NSSF is targeting health, developing health, promoting health information, reducing mortality, ensuring that we get there with the target of 2030. So everyone should be interested.
I am extremely delighted to be here. The objectives of the Nigerian Solidarity Support Fund completely aligns with the 10-Gen Family Office objectives, and we're essentially partners for lives, and we're passionate about what they do and this initiative.
I truly believe that we should all stand up for one another, and that the private sector does indeed have a lot to do to build our health sector.
So what is NSSF's strategic focus? Our focus is in three. Really, one focus is to improve the access to quality healthcare for vulnerable Nigerians. And we want to do this in three ways. The first is to provide sustainable, and the key word there is sustainable, health insurance for vulnerable women and children. The second is that we want to build the capacity of healthcare workers so that they can, prevent these preventable illnesses. And lastly is that we want to provide essential medicines and commodities that will aid maternal and child health services.
One of our main planks is also reskilling and retraining the Nigerian youth to develop and move people out of poverty and help the vulnerable. Healthcare is not just about building hospitals and painting walls and putting beds. It's also about the healthcare professionals. So we want to put pride back into those professions and help people sort of aspire.
Our population growth has more or less outstripped the infrastructure available, and therefore there's a need for an urgent intervention. The government has a lot to play, but the government can't do it alone. And that is where initiatives such as this and well-meaning individuals can then come into play to bring in what they can to build that sector.
The objectives of the NSSF is very laudable. Something that I totally align with, and in any little way I'm able to have been able to contribute.
For the first time, we are doing something, helping ourselves as an organization and saying, let's do it for ourselves. And I'm sure we have more international backup when they see that we are taking interest in the health of our people. Health is a development issue and it's very important.
Sub-Saharan Africa in the world contributes 68% of maternal mortality in the world, and Nigeria alone contributes 20%. That is alarming. That's alarming. And if we look at the SDGs by 2030, we should actually be having just 17 maternal deaths per 100,000 live births. And as at 2022, we're at 814. That means that there is a lot of work to be done in the health system.
Personally, I have been affected by the lack of healthcare in our system. The fact that we don't have social security is also something that, means that we all have to lend a hand.
One of the sponsors of NSSF is actually Global Citizens. And Global Citizens, their main objective is to end extreme poverty in the world. Objective is to help achieve those sustainable development goals that the UN has set out.
I see a greater nation in Nigeria, and so I want to put in my best and all that God has put in me to ensure that we bring out the best of the nation, Nigeria.